everybody?
Yes, they've got them. Okay.
Yeah.
Wait, I'm just going to put the first sentence
The other thing is, I say something. I got no right to be given my own my neighbour, because she's been typical, I'm doing nothing has happened. I thought she's wait for a week now, I'm about to go away. We're doing it just something it's limited bed and breakfast, and the Thames part, we don't want to stay too far away. No, it's finding this sort of place, so I'm making it quite occasional. It's only doing 5 hours a day, we don't do the back straps for things next time.
Okay, good afternoon, everybody. Hi. Thank you for coming. We are a few minutes late in order to let late arrivals to reach the venue, but I think many people are still missing. But it's good to start anyway. So my name is Andrea Cipriani. I'm a psychiatrist. I work at the Department of Psychiatry in Oxford at Woodford Hospital, and I'll give my talk later in the afternoon. My role today is basically to introduce and manage the Q&A session after each presentation. And the only thing I'd like to say at the beginning, as a welcome to everybody, is we all agree that mental health is very important. And I think for GPs, especially for the kind of issues, clinical issues we are going to discuss today, GP land is the front line for this kind of patient. So in my mind, this is more an interactive session rather than presenting data. It's more about hearing what you have to say and questions and feedback, because it can be a starting point to work together and collaborate. It's not just today, we can also organize other events and outreach, not only patients but also doctors and GP surgeries in the whole county, not just around the big centers. I think Katy and Vicki shall we start? So we kick off and talk about CAMHS as a single point of access. The idea is to have 20-25 minutes presentation and then 5 more questions. So thank you very much.
We're going to try and talk about the microphones, if that's okay with yourself. If there's anyone that is struggling to hear us, do raise your hand at any point. Is there any difficulties in hearing what I'm saying so far? No? Okay, lovely. So my name is Katy Fitzgerald. I'm a senior mental health practitioner in the single point of access team at Buckinghamshire CAMHS. I'm a social worker by background and been working with children and young people for about the last 11 years. I'm also the training lead for Buckinghamshire as well. We provide prep training, and we'll talk a little bit about that.
My name is Vicki. I am a specialist practitioner for all neurodevelopmental disorders, so I work within the single point of access team, but I also overlap the neurodevelopmental pathway within CAMHS as well. So my background's in neuropsychology and predominantly worked with young people and adults with autism and ADHD.
Okay, so we just wanted to speak initially. I don't know if it's quite large enough for everyone to see towards the back, but talk a bit about our service model, because we have had some changes recently. The purpose of our single point of access team is we are the front door to Buckinghamshire CAMHS. So that is for any young person that is registered with the Buckinghamshire GP. The only exception for that might be if a child is looked after and they are looked after under the Buckinghamshire local authority but might be residing somewhere else. We provide consultations to professionals, to parents and to young people. So that's available from 8 till 6 p.m. daily, Monday to Friday. We can give out the telephone number shortly if anyone's not clear on that or aware of that. We receive all referrals that are incoming. We clinically screen those on the day. We've got about 6 members of staff in the team, would you say? Looking at that, we will try and call people back on the day if they've requested a consultation. If there are particular risk issues or something that is of a more urgent nature, then we do ask that people let us know that when making those telephone calls. In terms of making referrals, we accept referrals from anyone. It doesn't have to be solely from a professional. So the parent can phone up, make a referral themselves. We've got an online referral form as well. Young people can refer to, depending on age. We would never turn a young person away. We would always want to ensure that they're safe. But there are obviously consent issues with particular individuals as well.
Just in terms of the consultations, that's also for young people and parents as well, so not just professionals. So anyone can call up if they are not sure if they want to make a referral or just want some advice that we could then maybe suggest it might be that it does need to go to being a referral.
So in terms of outcomes, so when it comes into the front door, as it were, of the spa, we will either make a decision about it not being for CAMHS, and we will always ensure that in any decline letter there's an explanation of why that might be or why it's not appropriate for us. We do try and phone every parent and referrers if we can do, whether that's a decline or if we're going to process that through CAMHS or make a referral to somewhere else.
Or it might be where we try and gather a bit more information because we've got some information in the referral, but in order for us to make a decision we need more information. Generally, we would always, if we were declining a referral, it's very rare that we would just decline it without any signposts or additional services that we feel would be more appropriate to support that young person. I think the only time we would ever decline without other advice is if there's already a clear plan in place that seems appropriate for that young person.
We have clinical discussions each morning, so we have like a handover of the young people that are open to our service. So if we are declining, we think about that collectively together in terms of what sounds like the best service for the young person. Then we've got the different pathways within CAMHS as well. So getting more help is sort of the old tier 3, as you might have known before. So that's for moderate to severe mental health difficulties predominantly. There's also the buddy service. I don't know how much you know about our Bernardo's buddies, but they are trained to deliver low intensity CBT. So that might be for mild, low mood or anxiety, and they provide 6 to 8 sessions. Getting more help is also the pathway where there would be risk management and care coordination as well. So we've got the separate eating disorders pathway, which we won't speak too much about because our colleague Jo is doing the next presentation. Vicki will be best placed to talk about the neuro.
The neurodevelopmental pathway, we will come back. We have got a slide specifically to think about because there are some changes that are going on at the moment, but generally that would be for young people where they need an assessment for autism or ADHD. We've got very few young people that we have that we will do kind of direct work with, because predominantly we will be doing work if there's underlying mental health concerns as well, which might sit within other pathways. So I will come back to that. The learning disability pathway, it would generally be for children that have got a moderate to severe learning disability and mental health concerns. For those that might have a mild learning disability, it might be that they can be supported within the other services, within the other pathways with reasonable adjustments. So it's just working out how that person can access the services. But it would be when there's also evidence of mental health concern, or in some cases if someone is presenting with quite high level of challenging behaviour, if they've got quite severe learning disability, we might not be able to verify if that's mental health, so that might be appropriate for that pathway as well.
We've got forensic CAMHS, that's known as FCAMHS, CAMHS, which is the harmful sexual behaviour service, and liaison and diversion. So liaison and diversion are a small team that work across Buckinghamshire and Oxford, and they tend to work with young people that might have come into contact with police and early sort of offending behaviours that might be known to loss. Youth offending service, they work really closely with PRUs, Aspire currently engage in full-time education, might be learning in a smaller environment with behavioural, social and emotional needs. We've got a specialist looked after children's pathway, adopted children's pathway. We would always look at the child's predominant needs in that moment. If it's a mental health disorder that we think is the predominant difficulty, then that wouldn't necessarily mean that that young person goes to the looked after children's pathway. It might be that actually they're better suited in one of the others. If there's some questions around potential attachment difficulties or a need for more individualised support with carers or foster carers, then that team can provide as well. Reconnect is a 0 to 2-year-old service. I don't know how much you would be aware of that, but that's usually when parents are known to social care and there are some concerns or difficulties with their own backgrounds or current mental health needs, domestic abuse, and questions about parents' capacity to meet the unborn or baby's emotional needs. There's specialist clinicians that will do a 6-month period of assessment, assuming parents will engage in that process, and that often feeds into a lot of core processes and outcomes for the children. And then risk support. So there's very clear criteria and threshold for this. We've got an outreach service known as OSCA and the crisis team. They're an award-winning team that provide out-of-hours support to young people that are at high risk of suicidality, self-harming behaviours, significant mental health difficulties that might need support around the clock outside of our usual Monday to Friday working hours. Their main approach is DET, and they also do risk planning, and they tend to work for up to about 2 to 3 weeks with a young person, supporting each other team is already working with a young person too. They also will assess at hospital too. If a young person presents at hospital, then they might be seen by a crisis clinician. I think that covers. So the aim of our single point of access team really is about prevention, and we'll go into a bit more detail about that shortly. Consultation and training as well, so we deliver PEP training. Intervention, so we do provide duty assessments as well, telephone discussions, speak to professionals, information gathering, and equitable access. So gone are the days of parents or young people needing to go via the GP, that there are other avenues, and we're trying to make that more forward-facing now. And that's kind of part of the transformation plan, as well as what we've had from feedback from young people at our young people's group and parents. So these are just our contact numbers. If anyone wanted to take those down. That's our current website as it stands as well. Training information, out-of-hours number. So the number here is the one that you can reach for consultation.
And our email address for training advice, if you saw our flyer around the different PEP modules that we run, that would be the email to contact us about.
Can we just check, when you say out of hours, you mean after 5? Because we all work till 6:30. So for us, somebody that pitches up with their daughter or somebody who's got an acute problem, it's 5:30. We ring your out of hours number, is that correct?
We're open till 6. So
Oh, 6,
yeah.
okay.
So we've got information down.
Just to say, we will circulate the slides around
Oh,
in
okay.
the next couple of days, so
Okay,
And all this information should be on the website as well.
So yeah, we're not going to sort of repeat ourselves. We've mentioned about referral criteria. What happens next? Yeah, we've kind of covered that as well. So we aim to make a decision within 3 working days. Obviously, if there is risk issues and if we need to address that, we'll make a call on the day to the parent and to the young person as well. If we don't feel there's a welfare service, we will explain why. And also signpost a more appropriate service too. There's other services such as bereavement counselling if it's bereavement specific. Those services can support a young person much better.
we also try to encourage that sometimes people have gone away not feeling happy with the decision that was made or not understanding why that decision was made. And we do encourage anyone, whether it be a professional, whether it be a parent, to call us if they want to find out more information why that decision was made, or they might not agree with it, or you might not agree with it, and it might be that you've got additional information that we weren't necessarily aware of. So you know, it's okay for someone to call up and to ask more information, and we might need to make that decision, change that decision.
So what we find really helps to streamline our process in CAMHS is really clear current mental health needs information. Often we get from other professionals, there might be reams of historical information. We really like to know that what the current difficulties are. Obviously, historical context is important. What has been tried is a really key thing, because in terms of early intervention, we'd be interested to know what the young person has been able to access prior, whether that's at school or outside of there in terms of counselling, what has or hasn't worked for the young person, and so that we've got a sense of what is going to work for them and what might not. And what is the expected outcome as well, so we'll say assessment from CAMHS, or an impression of, from the discussion with the young person, whether you know that young person well, what their expected outcome is as well as parents.
Because we get quite a lot of referrals that just say for ongoing support, and it would be helpful to have kind of more of an idea about what you feel is genuinely needed for that young person, just so that we can then better understand where it might need to go.
So just to talk about our transformation plan, so part of that was to develop the single point of access team. So it's been running now for about 4 or 5 years. And Oxford are a little bit behind. They started last year or the year before, I think. But really it was about, so we have school link worker roles. Every primary and secondary school have a link worker from CAMHS that they can speak to with regards to any mental health difficulties or concerns that they have for a young person. We've got the introduction of education mental health practitioners that are just starting in post. They're training at the moment, but they're going to have patches of areas that they're going to work within schools and be forward-facing and a face within the school as well. The training, which we'll speak about in a bit more detail. Reducing the amount of inpatient admissions via Oscar and crisis team. Recruitment and retention of staff, which is an ongoing. The consultations and continued work around the transitions for young people as adult services. So that's an ongoing challenge, which I'm sure you experience as well in terms of getting the right thing, support people as they raise that knowledge.
And we also run kind of pre-referral support for parents as well, so particularly in schools where they might identify a lot of young people that have anxiety. We do run parent anxiety groups just so that they understand the nature of anxiety, what they might be able to do to help change that cycle. So normally we do that to try and reduce the likelihood of them needing services further down the line.
So we've spoken a little about this, so we're providing advice and guidance to schools, working in schools, providing low intensity CBT for mild anxiety and low mood, where that's appropriate. There'll be screening for mental health in schools and then linking with ourselves in SPA. So there's 8 workers that are currently in training at the moment, and it's it's not for every school for education mental health workers. It's schools that have signed up to the agreement, so it's not every school across Buckinghamshire.
Sorry, you said the educational mental health work is different to the individual workers.
Yes. So
They prefer to you, or do they
they tend to meet with us in SPA rather than, if they've already got an understanding of it, it makes sense for them to have those discussions with us.
So I don't know how much everyone will be aware of kind of the more recent changes with the neurodevelopmental pathway. So previously there was a division between paediatric services and CAMHS around the assessments. So it used to be that children over 11 for autism and ADHD assessments would be completed within CAMHS, or if there were children already open to CAMHS under 11, it was probably more appropriate for us to do those assessments. But under 11 would be community paediatrics. So that's now changed as of the end of January. So So now for children 5 to 18, all of those referrals would come through to the single point of access team in CAMHS. And we would then triage it and identify if it was likely that a young person needed an autism and ADHD assessment. We're still very much in early days about how that service is going to look. So the idea is that assessments will be completed between community paediatrics and CAMHS as a joint service, so that it will be needs-led rather than age-led. So there are panel discussions about, for example, if a young person had a lot of health needs, it might be that a community paediatrician would be far more appropriate to do that assessment, whereas if there's a lot of concerns around attachment or other different things like other trauma or other things like that, it might be that CAMHS clinicians more appropriate. So hopefully these assessments should be much more tailored to the young person's needs. It's also been kind of put in place so that this process should be a lot smoother, a lot quicker. So the screening tools that we're going to be using are going to be made available online so that they can be completed as part of the referral, and then we have all the information at that point to make a decision whether someone is to go and have an autism and ADHD assessment. The hoping is also that will then reduce the length of time people are waiting for assessments. It should be a much quicker process overall. And what at the moment, whilst we know that people don't necessarily have the screening questionnaires, what we're doing is sending them out. Once we've got that information back, we can then look at all the information. As long as we're sure that there are no other mental health concerns that we need to be aware of, they can go through that neurodevelopmental pathway. In a nutshell, that's kind of, but there's lots of changes that will go on, and obviously it's developing as we go.
And equally, if we have any questions about that process, then do utilise our consultation line for that.
I suppose actually the one thing I haven't mentioned is that it can be that parents can self-refer, so it's not restricted to being professionals referring. So we've had quite a lot of self-referrals since we've started this service. And that's absolutely fine. What we do then is send the questionnaires for school and home, so we've got information from both settings to help make a decision.
So that's at any age now? So it used to be
5, it's from 5 plus. So
it used to be 16 plus, didn't it? You had to be teenage.
it's generally been 11 plus, yeah. Yeah, but so under 5s will still sit with community paediatrics. 5 plus.
Are they the same as the strengths and difficulties questionnaires you can just find yourself online, are they?
No, they're slightly different. So previously we used to use things like SSQs for autism participants, CAST for under 11s, Vanderbilt's we used to use. We're now using qualitative forms because we find there's a lot more information we can get from those. So we've got a specific one for school and for parents. And generally they will cover both autism and ADHD, so we've covered everything because we know that there's often a lot of overlap. So at least then we've got all the information to make a decision of what they might need.
So how do these GPs get those forms?
So they should be made available on the website. I'm not sure if it's gone live yet, if it's on there, but at the moment we've been sending them out directly to parents. Generally we do find that it's better to send it to parents, and we say to them it's their responsibility to get those to school and back, because otherwise what happens is schools don't send them back and it makes it really tricky.
I've had a couple of cases of referring in and being told by parents you need to do the questionnaires first, but I haven't been given the questionnaire to the parents, so I just think I'll be missing something about how they're using it as well. I think should be coming from us.
Yeah, so I mean at one point we were emailing them out whilst it was quite new. We wanted to try and make sure we were moving things on quite quickly. Now what we're generally doing is sending them out in the post, and then we can reopen the referral once we've got all the information.
If we gave the patient forms at the beginning, then that would get the process much quicker.
So that's definitely the ideal, and I think what we recognised at the beginning is that whilst that wasn't out there, we couldn't expect people, couldn't decline referrals on the basis that we didn't have those. So that's why we're sending them out so that everyone's
So they're
got
on the
them.
website,
I believe that if they're not already on there, they will be. But at the moment, we're making sure they're going out. But if you did want to call in and get those forms, we could do that and send them to you. But hopefully, it should be on the website. Yeah.
Yeah, so just in terms of the school link worker, so generally for all primary schools it will be a Bernardo buddy that is the link worker, and then a clinician within CAMHS for secondary schools. So schools should be receiving resource packs, signposted information, and contact if they need to request updates and information if they know a young person's open to our service and not clear where they might be at in terms of the assessment process. Then the school link worker can do that. and support with any training needs for the school too.
Excuse me, can I just ask just on that, if you could go back, there was a description just earlier about the University of Reading educational mental health practitioners and the link to this. So could you just be absolutely clear about that? Are they in CAMHS already? Is
So
that right?
school link workers are already either NHS employees, clinicians, or they're Bernardo's buddy.
Yeah.
The education mental health practitioners are studying at Reading Uni, or will be NHS staff,
Yeah.
but they're in training at the moment, and they will be sitting in the schools, working within the schools. So there might be some overlap, but there's still a role for some of the school link workers, particularly if they want to chase a referral or want an update on where the young person is.
So the young people that are working with the Bernardo's, but the CAMHS link worker, are already in CAMHS, is that correct? Yeah.
With the CAMHS link worker, that would be generically for that school though, in terms of necessarily young people that are open, so they might link in around children they want to refer or children they're not sure about as well.
Okay. Thank you.
So on PEP training as well, which I think Inika will be speaking about a little bit later, but we deliver PEP training, which is psychological perspective and education in primary care. And there's various modules that we deliver to professionals. We do 15 modules a year across Buckinghamshire, and then we do more bespoke requests at schools, after school, on inset days, for foster carers and that sort of thing. And these are just some of the modules that we deliver to. That's it. Any questions?
Can I start with the school link worker? So, is it every school? So is that secondary school level or primary school level?
So every school will have a school link worker assigned to them. So for all primary schools, it is a Bernardo's buddy, and all secondary schools is a clinician, so a senior mental health practitioner.
Is that for private schools?
No, at the moment it's not, but I mean, in terms of private schools, they can call in consultation, the same as anybody else can, but no, they haven't got allocated work, unfortunately.
It can be quite a few weeks before we hear back following our triage. So can we take it that that's going to be faster for now? Because currently we've had a referral that you've done some finance support, rather than offering a quality assessment. It takes something that's less about 3 or 4 weeks later. And if you're saying you've actually made a decision within 3 days, that just seems like some
It
gap
doesn't
for
reflect
parents to be waiting.
I think there are some challenges at the moment on the administrative side, so we're making the decisions, but actually there's a difficulty on the admin side of things of getting those letters out in a timely fashion, and that's something that management are aware of in terms of staffing at the moment being able to do that. I think there's been a challenge with that alongside the new neuro pathway coming in as well, and the sheer volume. But if you haven't heard for a couple of weeks and you've got a family that are phoning and saying, actually, I'm really not sure whether to ask them to phone us if we haven't spoken to them already, or we'll happily give that out on the telephone as well.
And when you say that parent would call,
I just want to clarify the number that they would use.
so it'd be the same number?
It's all the same number.
Yeah, all the same.
So I can give patients that same number and say, you're allowed to call this number, discuss your concerns, and you will triage that.
Yeah, I mean, I suppose in terms of the consultation, we could then identify if it needs to be as a referral.
Yeah, or I can fill out the form that you just talked about. Okay, thank you.
Any other questions? Can I ask a question about, so you mentioned ADHD. So what's the pathway, how does it work? Is it the kind of developmental disorders?
Yes, that would sit within our neuro collaborative pathway as well.
And you link with all the people involved in the care of these kids with ADHD, school level?
Yeah. So we would always get feedback from the school in terms of how the young person's presenting in school versus at home as well, because we know that can be different.
And then depending on the assessment, if the young person was being assessed for ADHD, sometimes it might be that there's enough information within the room to make that decision. In some cases it might be that there's more information that needs to be gathered from school, so it would always be dependent on the young person's needs as needed. Yeah.
Any other questions? No. Thank you very much. I think we change a bit